This video discusses the general pathophysiology of injury and its progression through different phases. It illustrates the injury timeline, spanning from Phase 1, injury prevention, to Phase 7, disability or recovery. The model highlights opportunities for prevention, mitigation, treatment, and rehabilitation throughout this journey. We begin by establishing the fundamentals of impairment and disability evaluation. We will explore key questions. What is impairment? What is disability? And what is a handicap? Impairment is defined as a loss of use, or derangement of any body part or function, as per the Guides to the Evaluation of Permanent Impairment. The World Health Organization defines it as problems in body function or structure, and the AMA refers to it as an alteration of an individual's health status. Disability is defined as an alteration of an individual's capacity to meet personal, social, or occupational demands due to an impairment. This includes activity limitation, which is a difficulty in performing or completing an activity. A handicap, according to the Americans with Disabilities Act, is a physical or mental impairment that substantially limits one or more of the major life activities of such individuals. Let's look at an example. A bricklayer who loses his right little finger has an impairment. However, he may still be able to perform his job, meaning he is impaired but not disabled in this context. In contrast, a pianist who loses their right little finger has an impairment and is also disabled, as this loss prevents them from playing the piano, which is essential to their occupation. The relationship between impairment and disability is complex and difficult to predict. The same level of injury is not always indicative of an individual's ability to participate in major life functions, especially with appropriate accommodations. Disability is influenced by a range of factors that can change over time. Impairment rating is a physician-provided process that links impairment with functional loss. It involves a consensus-derived percentage estimate of lost activity, reflecting the severity of the health condition and associated limitations in activities of daily living. The purpose of disability evaluation is to assess an employee following illness or injury. It determines the extent of impairment and disability, evaluates the employee's ability to perform their previous job, and assists in designing a return-to-work program. Permanent impairment assessments establish diagnostic criteria and an evaluation process, incorporating scientific evidence and medical opinion. Assessments, conducted by specialists like CIME or CMIA, help determine claims, informing the claims manager who is ultimately responsible for the final determination. Certification for impairment assessors includes the Certified Medical Impairment Assessor in Malaysia, organized by SOCSO and NIOSH. In the U.S., the Certified Independent Medical Examiner designation is offered by the American Board of Independent Medical Examiners. The Certified Medical Impairment Assessor, CMIA, is a specialized medical practitioner in Malaysia certified through PER, KESO, and NIOSH. This 5-day program trains them to evaluate functional impairment and disability for compensation purposes, focusing on work-related injuries, rehabilitation, and prevention. ACMIA is a professional specializing in assessing medical impairments, often in occupational health and safety contexts, with certification offered by NIOSH. They are involved in assessing the extent of medical impairments relevant to workers' compensation cases and occupational health evaluations. The CMIA training program provides medical professionals with the skills to assess and evaluate impairments. Topics covered include anatomy, medical terminology, disability evaluation guidelines, functional assessment techniques, and legal and ethical considerations in impairment rating. The Certified Medical Impairment Assessor, or CMIA, primarily focuses on the evaluation and quantification of permanent impairment, particularly for occupational safety and health and workers' compensation claims. Unlike the generic CIME, the CMIA is closely associated with NIOSH Malaysia and is a localized framework tailored to Malaysian legal requirements. The concepts and philosophy of CMIA are founded on providing standardized, objective, and defensible assessments of permanent disability and impairment. This involves standardized impairment rating using the AMA guides and maintaining medical objectivity by acting as an impartial expert, focusing solely on medical evidence. The CMIA designation serves several purposes, including ensuring quality in OSH and SOCSO claims and harmonizing the assessment process by requiring the use of the AMA guides. It also provides legal and administrative clarity through quantified medical opinions for claim settlement. Practical applications of the CMIA include conducting medical examinations for SOCSO claims, providing objective baseline measurements in occupational health practice, and serving as an expert witness in personal injury litigation. They also evaluate claims for total permanent disability in insurance claims. Certified Independent Medical Examiners, or CIME, is a service of the American Board of Independent Medical Examiners. It allows health professionals to rely on physicians listed in ABIME's directory. To be included, physicians must meet requirements like possessing an unrestricted medical license and proving competency through an examination.